Today, we will briefly discuss diabetes. Diabetes is a very bad health condition that can wreak havoc on the body and internal organs if left untreated. Diabetes is one of the top negative health conditions facing Americans today. This is a very serious health condition and affects a massive portion of our communities. It's very important to adopt a healthy lifestyle in order to manage this chronic condition. Diabetes is a chronic medical condition that occurs when the body is unable to properly regulate blood sugar levels. There are two main types of diabetes: type 1 diabetes and type 2 diabetes. The cause of type 1 diabetes is when the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Also, the body produces little or no insulin, a hormone necessary for glucose to enter cells and provide energy. Often, in order to manage this condition, you may require insulin injections or the use of an insulin pump to regulate blood glucose levels. This designation is for children and teenagers. Type 2 diabetes is when the body either resists the effects of insulin resistance, or does not produce enough insulin. The body does produces some insulin, but it is insufficient or ineffective at managing blood glucose levels. This designation is primarily for adults, but can be diagnosed in adolescence. There is also another type of diabetes. The third type of diabetes is called gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy in women who didn't have diabetes before becoming pregnant. It usually appears around the 24th to 28th week of pregnancy and typically resolves after the baby is born. However, it requires careful management to ensure a healthy pregnancy and delivery. Pregnancy hormones can interfere with the body's ability to use insulin effectively, leading to insulin resistance. Some of the risk factors of gestational diabetes are being overweight or obese, having a history of gestational diabetes in a previous pregnancy, family history of diabetes, and being older than 25 years. All hope is not lost. There are many ways to effectively manage diabetes. The first step is to schedule an appointment with your primary care provider. They will be able to provide the best recommendations for managing this chronic condition. Your primary care provider may have to run some diagnostic testing in order to confirm a diagnosis. On the other hand, there are some things you can do at home to manage this condition in conjunction with guidance from your primary care provider. Managing diabetes effectively involves a combination of lifestyle changes, medication, and regular monitoring. Here are key strategies to manage diabetes: healthy eating, which consists of a balanced diet, and reducing high amounts of sugar. Regular physical activity is a must. 150 minutes of regular physical activity a week is a good place to start. Also, you may want to avoid alcohol, smoking, and implement other activities in order to manage stress. Diabetes is not something to take lightly. It is one of the top causes of death in the United States. Minority communities and historically disadvantaged groups face more challenges as a result of the social determinants of health. That's why it's important to take diabetes and all of the factors that influence this condition very seriously. The information in this video has provided you with a basic understanding of diabetes and why it's detrimental to your health and well-being. I hope you enjoyed the video and will continue to support this type of educational content.